So we're just giving them some time. My name is Sandra Ortega. I'm from the Northern Nation, Tucson area representative on NIHB. I'm glad to see all of you here. Thank you for sticking to the very last hour. So I want you to give yourselves a hand for staying to the very last hour. I hope that you have enjoyed the last couple of days. It is our hope that you return home with new information to share with your communities. I also hope that you enjoyed the bird singers at Culture Night last night. Let's give them a hand. I also want to thank you for joining us for our closing plenary. We have mentioned our sponsors. There are so many people that we want to thank. We'd like to take this opportunity to mention again our appreciation for their support. We'd like to thank the Pew Children's Dental Campaign. The Pew Children's Dental Campaign promotes cost-effective policies to expand access to dental care for underserved communities and populations. NIHB would also like to thank the Centene Corporation. Centene is dedicated to helping people live healthier, more productive lives and believes that the best health care is health care that is delivered locally for timely, appropriate, and quality care for every individual. We also want to acknowledge the California Rural Indian Health Board, CRIP. Let's give them a hand. CRIP is committed to the needs and interests that elevate and promote the health status and social conditions of the Indian people of California. Before we invite our guests on stage and continue with our scheduled panels, we would also like to say thank you to everybody who took time to complete and return the survey on the Health Insurance Marketplace and Affordable Care Act. How many of you turned in those forms? A few? This information will help to inform future outreach and education activities on this important law. And so at this time, we'll be drawing some names from a pool of completed surveys for winners of the beautiful Pendleton blankets. But before we do that, I just wanted to say hello to each and every one of you again. Some of you I have not seen since New Year's. It's still New Year's, right? I also wanted to tell you that I have since left my past behind because it's a new year. So if I owe any of you money, I'm sorry, I have moved on. But good things come to those that wait. So we'll be doing our drawing right now. If you did turn in your paper, the survey. We have a number here. 8769652. 8769652. Not here? Maybe they went home already. One more time. 8769652. Okay, how about 8769609? We have a winner over here. Is that Gomez? Okay, congratulations. The next one I have is has a name on here, Michelle Gomez. Michelle Gomez. Anybody want to be Michelle? Not here? Okay, the next number is 8769626. 8769626. Nobody? Is it like bingo? You're waiting for the one last number? Okay, how about 8769604?
All right.
I hear a woo over there. A winner. So we have a second winner. We have one more to go. This number is 8769618. We have another winner, another woohoo.
Ooh, all right.
All right.
Lucky corner.
Okay, congratulations to all the winners. They all seem to be coming from over there on that end. Okay, congratulations again, and thank you to everyone who helped us with this project. Let's give the winners a hand. So it's good to fill out those survey forms, right? I hope you all have been filling them out because that'll help us plan our future gatherings. So you're helping us, and we help you in return. Okay, so at this time, Robert Foley, NIHB Acting Director of Public Health Programs and Policy, would like to provide us with a couple of reminders. Robert?
All right, well, I wanted to thank everybody for taking the time away from their families, their desks, their communities, to spend a week with us here in sunny Palm Springs. We hope that you found everything worthwhile and worth the time that you expended. We really appreciate it. I also wanted to remind everybody that things are not done yet. All right? Not only do we have an exciting set of panels for you this afternoon, we also have a full day free institute tomorrow running on health information technology and electronic health records. All right? The name of the institute, I want to make sure I get this correct, is Taking Technology and Innovation Beyond the Cloud, a new vision to improve tribal health. The session will be held in Kauea rooms B and C from 9 a.m. to 3 p.m. Again, it's a free session, so even if you are local and you're working with local organizations and tribes, feel free to let them know that they can come and they can attend this session. You also have flyers that provide a little bit more detail on tomorrow's health information technology session right at your seats. Of course, if you haven't heard me talk enough this week about program evaluation, one last time, we're going to ask that you complete those evaluations at your seat before you exit the plenary. We do look at those. We do value your input and your feedback, so please take a second to fill those out. I do want to let everybody know, thank you. I really appreciate you letting me take the time, my little 15 seconds in the spotlight, so to speak. But I also want to thank our panelists that we brought together today. So I'm going to ask NIHB board member Tim Tallchief to come up to the podium to introduce our first panel for some discussion on commercial tobacco use in public health policy.
Thank you. Thank you so much. Good afternoon. Again, my name is Tim Tallchief. I come from Oklahoma. I represent Oklahoma, Texas, and Kansas on the National Indian Health Board, and I'm just happy to be here to facilitate this afternoon's very important panel. Despite an overall decrease in smoking by all populations in the last 10 years, the prevalence of smoking is still higher among American Indians and Alaska Natives than any other racial or ethnic group in the United States. Similarly, Native Americans suffer disproportionately from illnesses such as heart disease, lung cancer, and complications from diabetes, resulting in smoking-related premature deaths and disabilities. While being careful to protect ceremonial use of tobacco, some tribes and organizations are tackling commercial tobacco use through the adoption of innovative policies. For example, some tribes are leading the way by adopting policies and codes that address smoking cessation and secondhand smoke exposure in vehicles. Some tribes are regulating exposure to commercial advertising that promotes smoking, and others are creating increasing taxes on commercial tobacco products. All of these means can be highly effective public health strategies if done correctly. This panel will discuss the details, challenges, and elements that contribute to a comprehensive commercial tobacco prevention strategy and the effect policy can have on reducing commercial tobacco-related health disparities. First, we will invite Kristen Rhodes to speak. Ms. Rhodes is an enrolled member of the Bad River Band of Lake Superior, Chippewa. She earned her master's in public health administration and policy at the University of Minnesota. She serves as the executive director of the American Indian Cancer Foundation, a national Native organization dedicated to eliminating cancer burdens for American Indians. Next, we will be hearing from Kyla Retzer. For the past 5 years, Ms. Kyla Retzer has been working as an epidemiologist at the National Institute for Occupational Safety and Health at the Centers for Disease Control and Prevention. She coordinates an industry and government work group that develops products promoting motor vehicle safety for the oil and gas industry. She has a master's in public health from the University of North Texas, which means she's still okay. Just so you know, in Oklahoma, Texas and Oklahoma have an interesting relationship. Prior to the CDC, Ms. Retzer worked in injury prevention within the Alaska Tribal Health System for 6 years. She has 2 young daughters. She is originally from Texas, but is currently based in Denver, Colorado, where they sell medical marijuana, which is not a tobacco-related issue. Is that correct? Okay. Next, we will hear from Isaiah Brokenleg. Mr. Brokenleg is a program director and epidemiologist for the Great Lakes Intertribal Council. Isaiah is an enrolled member of the Rosebud Sioux tribe and grew up in South Dakota. From a cultural perspective, as a Winkte, Isaiah believes that he is called to be a healer and move communities in the direction of positive change. From an academic perspective, Isaiah has a bachelor's degree from the University of Minnesota with majors in multicultural studies and applied social justice, human rights. He has a master's in public health from the University of Minnesota. And finally, we will hear from Chris Cooper. Mr. Cooper is a health education specialist with the California Rural Indian Health Board with a strong background in tobacco prevention. Mr. Cooper is a client-focused manager in social services and education with a progressive career spanning over 16 years. He has worked with high school students to research tobacco advertising in communities and worked in partnership with Legacy Foundation to develop a pilot smoking cessation program for tribes to help lower the smoking rate in low-income families. He has also worked with the tribes and hospitals to offer free smoking cessation classes to low-income families. Ladies and gentlemen, please join me in welcoming the panelists to the floor, if you will, please.
Ready? Well, hello, everybody. Thank you for the opportunity to be here today. I'm just really honored to be a part of this closing plenary session. I wanted to say thank you to, first of all, to the Agua Caliente Band of Kahiwa tribe for allowing us to gather here in their beautiful home. And thank you to NIHB for organizing such a fabulous conference over the past few days. Commercial tobacco addiction is an epidemic in Indian country, and it's causing major public health crises for our people today and for generations to come if it continues the way it is. Smoking remains the highest cause of premature and preventable death today in the U.S. For all people. Too many of our loved ones are currently suffering from smoking-related illnesses, and we've lost too many people before our time because of this preventable cause of death. Our communities cherish and rely on our elders, and yet too often they're gone before we're able to fully embrace all the wisdom that they have to offer us. Of course, commercial tobacco not only affects people who smoke, it also impacts the families and our communities as well. Tobacco-related illness causes unnecessary physical, environmental, and financial burdens on all of our tribal communities. Every tribal community is currently burdened with a mountain of medical expenses associated with the high rates of smoking in our communities. And according to the American Cancer Society, if you factor in these costs, the actual cost of a pack of cigarettes is $35 a pack. And we complain about the $6 to $7 a pack that we see in the stores, but the cost is much more extensive for our communities. When we talk about commercial tobacco, we need to separate out and remember that traditional tobacco is key to us as Native people. For many of our communities, we have so many tribes that are just beautiful and diverse. All you have to do is look around this room and see that. And for many of us, commercial tobacco or traditional tobacco is what is central to us as Native people. We use it on a daily basis to keep us healthy and strong. And that traditional use has to be differentiated when we talk about the negative impacts that commercial tobacco is having in our communities. Commercial tobacco is the tobacco that is chemically laden, is bought in stores, and is manufactured for the purpose of profit and addiction. That's not the tobacco that we were given by our Creator. Our tobacco is usually a mixture of tobacco products, and sometimes not even tobacco in that product, but we refer to it by many of our tribal names. In my region, as an Anishinaabe person, Kinnikinnick is what we use for traditional tobacco use. And it's been part of our lives and our ceremonies since time immemorial, and that's not going to change. When we think about how commercial tobacco has impacted our communities, we have a new product that we need to be looking at in Indian country. And this is really what, oh, I'm not advancing my slides on the thing, am I? I'm sorry. Where is I'm going along here doing my presentation. Thank you, Robert. So I'll give you a minute to catch up with me and where I was just heading on my own. I can't really see that screen down there. Sorry. So our Indian tobacco is not the commercial tobacco you buy in the store. Again, that Indian tobacco is that traditional tobacco that we gather and harvest as Native people. And a lot of our communities are reclaiming these protocols and moving away from the commercial tobacco that we can access so easily by purchasing in the store, but really reclaiming those protocols and those teachings about going out and gathering according to certain times of year. We don't do it all year round, but when we do go out, we have to plan and prepare to have enough to last us all year long. This is what I was talking about when I said this is the real product that's happening in Indian country. When we talk about commercial tobacco in our communities, this is what's happening. This is what should be on every pack of cigarettes. Again, smoking is a public health crisis for American Indian people, and a lot of times it's hidden by a lot of denial and addiction. We don't want to talk about tobacco because it's so prevalent, and so many of the people we love are caught up in this addiction, and it can be really hard to address, but we need to start addressing it, again, for our loved ones today and for the future. And we have to keep it into context that smoking is really tied to the stresses and a lot of the traumas that we've faced as Indian people. We know that impacts this addictive behavior. The tobacco issues are complex, and again, it ties to the historical context of over more than 100 years of federal policies that have tried to terminate the unique government-to-government relationship between Indian tribes and the U.S. government. These moves had negative impact on Indians and have destroyed communities. American Indian children were separated from families during the boarding school era and were deprived of teachings and traditional ways of knowing. And since many of the ceremonies were lost, and traditional tobacco knowledge was not necessarily passed down to the next generation. What we know with the data that's available now is that American Indians face alarming health inequities in cancer incidence and mortality. Rates vary by region and by tribe, but are really closely tied to smoking rates across each community. And we have seen these gaps widen and not get closer together. And so this is an opportunity to really change the future of our communities by addressing tobacco. The American Indian Cancer Foundation is dedicated to doing this work in partnership with communities. We don't do anything alone. We do it all in partnership with all of you, with our many partners. Our approach is really working with communities, and we know that's where the wisdom is. I'm going to wrap up here, having an opportunity to just share the effective solutions we know need to be based in promoting a youth understanding of positive and destructive uses of tobacco, improving systems to engage smokers to quit, developing and implementing cessation programs that work for Indian people. I didn't keep up again. I'm sorry. And now my time's up. And encouraging and supporting policies for smoke-free environments. These need to be tribally driven strategies for a successful way, and as Native people, we need to rely on our strengths and our culture in order to see success. And we're not talking about each tribe and each of our communities having the same answer or the same strategy, because that's not going to work. We're all different and we all need different things. So we really need to pay attention to that when we're talking about tobacco policy. Thank you very much for your time, and turn this over to Kyla.
Hello, everyone. My name's Kyla, and I represent the National Institute for Occupational Safety and Health. We are the institute within the CDC that focuses on safety and health of workers in the U.S. We fairly recently began an American Indian Alaska Native initiative to work more closely with tribal communities and tribal nations. So we're really honored to be here. This is our second time at this meeting, and we have more people here than we did at the last meeting, and so we're really excited to hear about what you're doing in this area, and very impressed with the roundtable I got to attend earlier on this topic. So since we're at a casino, I thought I'd make 7 points on tobacco cessation. I thought that would be a good number. Primarily I'll be focused on the workplace setting, since that's the area that we specialize in, but I'll make a few points from a CDC general public health perspective as well. So as most of you know, it's been just over 50 years since the first Surgeon General's report came out about the health consequences of commercial smoking. Since then, so it's been about 50 years since then, there's been about a 50% increase in smoking in the U.S. among adults. So from 42% in 1965 to 18% in 2013. So we have had some success. Within the workforce, it still varies widely. Blue-collar workers have the highest prevalence rates. The construction industry, mining industry, and food services have the highest prevalence of about 1 in 3 are smokers. And especially those workers who are exposed to higher levels of workplace dust and chemicals have the highest smoking rates. So the biggest piece of information I have from the NIHB world is that we just last week released our third, what's called Current Intelligence Bulletin on the topic of workplace tobacco policies. And this is available on our website. The name of it is the Promoting Health and Preventing Disease and Injury Through Workplace Tobacco Policies.